Chantix to quit smoking. Zyban to quit smoking. Well, how about something non-toxic without the potentially dangerous side effects? Well, the American Journal of Medicine just came out and said that they suggest that people try mainstream approaches before they try alternatives. Now, does this even make any sense?
No, give me the drug, give me the side effects. Something like Chantix is a disaster. How that got past the FDA, Vicki, I have no idea. When you look at all the depression and the suicides that occur from the use of Chantix, it's amazing. And why the authors would come up and say, even though they did a study that looked at acupuncture and hypnosis and a little bit about infrared laser therapy, how would they even imagine to make the suggestion that you should use a drug or nicotine patches first? It just doesn't make any sense. That's the allegiance that a lot of researchers have. They don't want to buck the mainstream, particularly if they're trying to apply for grants from people who are looking at things like that.
So it's always push the drug to quit smoking. So if you want to quit smoking, first of all, you need to want to quit smoking.
That's right.
That's a big deal right there. You need to really want to do it. Because if you really want to do it, you might even be able to do it on your own.
However, a lot of people do.
However, cigarettes nowadays are so filled with chemicals and things to make you more addicted to them than it was, than it used to be in the past.
That's right.
But anyway, some people can do it on their own. There's programs in the American Cancer Society to help people quit smoking. But this hypnosis seems to help a lot of people, as well as the acupuncture. So why not try that first? Then if that doesn't work and you're really in a bad way, consider counseling or some of the other therapies that are recommended.
Right. Well, it's an addictive behavior, and it's one of the most addictive drugs that there is. Cigarettes have a lot of things in them, like Vicki was saying, that tend to make the addiction worse because, let's face it, the tobacco companies are unscrupulous and they're interested in the bottom line, which is return on investment. They don't give a stuff about you, but they give a stuff about your money, and they want that. So when these other approaches are looked at, it's surprising how effective they are. I mean, acupuncture works in a lot of studies in the vast majority of people who do it, and it's fairly lasting. Hypnosis is the same thing. Now, the people that did this study that was published in the American Journal of Medicine noted that some of the studies didn't have the positive results that other studies did. But you also have to take into account who did the study and what was their skill level, and how much experience did they have at working with people to quit smoking.
And did the person really want to quit smoking? I mean, years ago I used to smoke, and sometimes I would try to quit because he wanted me to quit.
Yeah, I sure did.
Well, then all we'd have to do is get in an argument about something, and then I'd think, oh, I'm going to go start
I'll fix him, I'll smoke.
I'll fix him, yeah.
Right.
So the only way that I was able to quit is I had to do it for myself. In fact, I didn't even tell him that I was doing it. Because I was afraid if I did, then I'd have to listen to him talk
I was
about
afraid
it.
to ask her if she was still smoking. I noticed she wasn't smoking as much. So that's fine.
Oh, you did? This is the first time you told me that.
That was about 30 years ago, wasn't it? Yeah. Well, I don't want to spoil a good thing. There are other treatments too. Infrared light can be used as a form of acupuncture. And when you go to some of the acupuncture points, particularly in this area right here, the success rates are like above 50%. And these are at 6 months to a year. So there are a lot of approaches out there that make a lot of sense because they're safe, they're non-invasive, they're easily available, and they work. When you're looking at drugs, you always want to be thinking about what's the side effect.
We also have a lot more on this site about quitting smoking, so if you want more information, just do a search.
You bet.